we have Dr. Kathryn Ruddy, who's a medical oncologist at the Rochester site, and the topic for Dr. Ruddy is managing the long-term side effects of breast cancer therapy.
Hello, and thanks so much to the organizers for inviting me to be part of this. I receive royalties from UpToDate, and I'm going to talk about a few drugs off-label. I thought I would talk about common symptoms and side effects in long-term survivors, and also about evidence-based management strategies. As you know, the number of cancer survivors is growing, and that's in part due to improvements in our treatment. In fact, over the 10 years between 2016 and 2026, it's been estimated that there will be a 21% increase in the total number of female cancer survivors and a 26% increase in male survivors. So these are of all cancers. That will total to approximately 4.5 million breast cancer survivors by 2026 in our country. And as you all know, the needs of a patient with cancer differ at the time of diagnosis than they do during treatment and in survivorship. And the kinds of symptoms that we manage during treatment, particularly during chemotherapy treatment, I'm a medical oncologist, those symptoms are quite different from the symptoms that we focus on in the survivorship period. Younger patients and older patients may have different experiences of this as well. Younger patients, the unique needs of survivorship may be particularly challenging, related to the fact that they may still be early in their career, they may have young children, the body image issues may be greater for younger patients, and then fertility and family planning may be a significant concern. Older patients, on the other hand, have their unique needs, including, I think very importantly, more comorbidities, more concurrent medications. You know, they may be taking 18 other medicines for their other medical conditions. So when we talk about being adherent to anti-estrogen treatment, that is just one more thing, which for some may be easy because it's sort of they already have their pill box and they know how to take it. For others may be more difficult. And certainly transportation can be difficult as we age. Monitoring, preventing, and treating long-term side effects of the primary cancer treatment is one of the primary goals of our care and survivorship. Certainly, as a medical oncologist, I would say I spend 90% of the time in my visits talking about that after chemotherapy is completed, or even for those who never got chemo but are receiving anti-estrogen treatment. And these long-term and late effects are sometimes related to local therapies. We heard a wonderful talk by Dr. McLaughlin about lymphedema. Particularly systemic therapies, we can cause cardiac dysfunction and neuropathy, which I'll be talking about today. Other side effects include osteoporosis,